So the last challenge I want to talk about here is PCOS. Or polycystic ovarian syndrome. You might also see it as polycystic ovary syndrome, but I feel like ovarian syndrome rolls off the tongue easier, so I went with that. So PCOS is a hormonal imbalance in the brain and ovaries that prevents ovaries from releasing an egg each month, and it affects around 12 to 18% of women in their productive age. It's actually a little bit higher in high-risk populations. I think it's around 21% in, say, like in the Indigenous women population, the Australian Indigenous population, that is. It can cause irregular periods, weight gain, unwanted hair growth, particularly around our face, acne, and it also, I've seen particularly girls presenting with really deep purple stretch marks from rapid weight gain. So just some warning signs. Again, I'm not trying to diagnose anyone, but if you've got a couple of these, they've been niggling, make sure you go and get checked. And so the hormones behind the scenes here are things like insulin and testosterone. They're the key hormones. Now, it's often PCOS is very under-recognized and under-diagnosed, and it's because very few women present, I should say, with the same set of symptoms. It can look very, very different. And one of the poster girls for PCOS was Victoria Beckham. So for those of you who are a little young, Victoria Beckham was Posh Spice and Spice Girls, really lean, tall, didn't have obvious weight gain issues, didn't have facial hair issues, didn't present with acne, but definitely had some challenges when it came to her hormonal balance. So common symptoms can be things like irregular or no periods, as I've talked about, facial hair, excessive facial hair, I should say, acne, weight gain, or difficulty losing weight, fertility issues, excesses, and also the main player here is it's the insulin resistance that's kind of playing in the background. Now, what came first? Was it the insulin resistance that's caused PCOS? Was it PCOS that caused insulin resistance? That's probably another golden question at the moment. Probably a little bit of both. And I think this is where our lifestyle kind of comes into it. So for most women, like as I've said, the underlying cause for PCOS is insulin resistance, and it's the difficulty maintaining a healthy weight. So definitely eating the right foods here really helps. As we've talked about, remember, insulin's role is really important, is about getting glucose out of the blood into where it needs to be and helping maintain normal blood glucose levels. And if you're insulin resistant, as we've talked about, your body doesn't use the available insulin effectively. So your body tries to make more and more insulin. So you've got really high insulin levels, really high glucose levels, and then we get into this real state. And that is what can lead the ovaries to produce more testosterone than usual. And it's the high testosterone levels or that imbalance that can often cause some of those symptoms, the telltale symptoms of PCOS. Eating healthy will definitely help you to lose weight, which when you lose weight, it's been shown to help restore ovulation, because that's often that's the first thing that sort of goes wrong with PCOS. It doesn't have to be much weight. It only needs to be around 5 to 10% of your total body weight. Now, definitely with the women that I've worked with PCOS, lower carbohydrate eating plans are usually an effective means to losing weight. not no carbohydrate. We do want some carbohydrate, but definitely lower carbohydrate diets I have had some success with helping women with PCOS lose weight. And also, what's really interesting is, as I mentioned earlier, intermittent fasting, when it's done right, and to again talk to the girls or anyone who referred you to this program about nutritionally supported intermittent fasting. But we definitely know that intermittent fasting can actually help reverse insulin resistance if you catch it early enough. So definitely something and there's been some really cool studies that have been showing that. So if this is something that you are challenged by or interested in, I think it's definitely something to look at.